So thank you everyone for joining us today for our, I think it was our third or fourth annual ambassador training. We're really excited to have you here. My name is Cicely McLaughlin. I'm the program manager for the Population Health Alliance of Calhoun County and the Battle Creek Community Foundation, overseeing the Ambassador Project. And we're very lucky and grateful to have Dr. Kantola from Oakland Hospital to come and train you all on not just the COVID vaccine like we've done before, but routine adult immunizations as well. So I will pass it over to Dr. Kantola, and then we will get started on her slides.
Great. Thanks, everybody. I'm Dr. Kantola. I'm a family medicine physician. I work for Oakland Medical Group, and my office is in Olivet, Michigan. I'm also the primary care director here. And so vaccines, have been, very something that, we've worked really hard to get community involvement in. And so there's been a lot of changes lately. Honestly, there's been new vaccines, there's been change in guidelines. And so it's hard to keep up on all this, even for doctors. So I'm really excited to share kind of the new updates today. And I know last time when I was here, what I really liked about it was there's a lot of input from you all. And so I do have a PowerPoint that I'll go through, but at any time, I would love for you to jump in, ask me questions, make this more of a conversation. Sometimes I get a little, I talk in medical jargon and I don't want to do that. So if there's something I'm saying that's unclear to you all, please stop and let me know. Okay, so everybody's seeing this screen from the adult vaccine, right? Okay, you can go to the next slide. Okay, and so just, staying up to date on vaccines, you're not only protecting yourself, but you are protecting the people that you love and your community members. It takes a village, and we are all, I believe we're all connected in this world. We all have an obligation to be there for each other. A very specific instance that comes to mind is I have not seen chickenpox in my clinic for many years. I've only seen it twice in my medical career. And I saw a 9-month-old with a case of chickenpox. She had gotten it from her grandmother, who actually was infected with shingles. And so through no fault of her own, she didn't know. But she, by, getting shingles, which is a vaccine preventable disease, she had passed on chickenpox to her grandchild. And so everybody knows that kids need vaccines, right? I mean, everyone, take their child to the doctor, they get educated on recommended vaccines, but there are adult vaccines that we routinely need. And there's not enough of us that are actually getting all the things that are recommended. And so some of the major barriers, at least that I've seen in my clinic, would be just a lack of awareness that adults even need vaccines. There's misinformation. There's a lot of vaccine hesitancy, especially after COVID-19, that keep people away. Cost and access. For some reason, there's some vaccines that are not paid for by certain Medicare plans, and they need to have that done at the pharmacy. I don't see this a whole lot, but sometimes there's fear of needles, and just basic complacency. So I see this all the time. Adults say, well, I've never seen this. I've never seen a case of measles. Polio's gone. We don't have this anymore. There's no reason to think that, I'm at risk of a vaccine preventable disease. Time constraints. And so all of us are super busy. I'm grateful when patients make time to come to the doctor for their preventive care visits, even when they're not sick. But it's hard, honestly. Health literacy. So just, understanding all the information overload that we're getting. Mistrust of the healthcare system. This has been a big one I've experienced just in, since COVID-19 more so than ever before. A lot of people don't trust that what their doctor is telling them is safe and true, which is, that's a big problem. So I want everyone, whoever comes, into my office, to be able to know for sure that I'm giving them the most accurate, up-to-date, unbiased opinion. And then as well as, there's this belief that we have natural immunity. Our bodies will take care of themselves and we don't need anything artificial in our bodies. And so for these are kind of the reasons why people are avoiding getting routine adult vaccines. So like I said before, just like addressing these head on is not just the job of doctors and hospitals, but the biggest impact can be made at the community level. Okay, and so first of all, I think the best thing that we can do tonight, just to give everyone some basic education, is making you all aware of which vaccines you need and when to get them. And so we're going to just kind of start going over those things. We'll go over each vaccine one by one. And please, like I said, interrupt me if you want to have questions. We're going to keep it brief because I want time at the end for conversation. Okay, and so we have the Tdap. This is your tetanus, diphtheria, and pertussis. Pertussis is whooping cough. You're vaccinated for this in childhood. However, you do need a dose every 10 years for it to stay active. If you have an injury, you step on a rusty nail, that's kind of the classic example. If that is a puncture wound that is dirty, you will get that vaccine in 5 years rather than waiting 10. We have the, and also when a woman is pregnant, she gets a Tdap during her last trimester of pregnancy. This Tdap given then is actually to protect the child. So that's recommended during pregnancy. If any of you have infants or you're exposed to, new babies, grandchildren, great nieces, nephews, it is very much recommended that you revaccinate against Tdap. Mostly because of the whooping cough risk, which is, that is a preventable disease that is very much active, and in our communities. The MMR, measles, mumps, rubella vaccine. And so most of us were vaccinated. This vaccine's been around for a long time. There's been a recent outbreak, even in Michigan here, we've had some cases of measles. We are seeing more and more because there's been a slight decline in childhood vaccination rates. And so whenever you see that, we do get pockets of outbreaks of measles. Even though most adults, think they've been vaccinated, you should certainly receive a dose if you do not have evidence of immunity to measles, mumps, or rubella. So if you were not born before 57, if you don't have documentation of an MMR vaccine, or if you can do a lab test actually to tell if you have immunity. And if none of these occur, then you should receive one dose of the MMR. Oops. Okay, so shingles and zoster. This is painful. This is something that you do not want. Anybody who's had chickenpox in the past, they can get shingles. It's a virus that actually lives in the neurons of your brain, so the cells of your brain. And at any given time, it can migrate down and create a blistering, painful skin rash. A lot of times, this outbreak will happen during periods of stress, sickness, when your immunity is down. We saw a ton of this during COVID, whether it been physical, emotional stress. Outbreaks of shingles is painful. There is a vaccine that prevents this. If you are 50 or older, you should get this 2-dose series. 2 doses, 2 to 6 months apart. It's quite effective. You get this from the pharmacy. Influenza, everyone knows that one. It's a yearly vaccine. There are higher doses that you can get if you are immune compromised or if you're older. It's usually available in August, September, October is when we start giving that flu vaccine. It's been quite effective. It changes every year, which is why it's important to get every year. They basically study the patterns of the most current influenza, virus, and then they tailor the vaccine to target that so it's most effective. So it does change every year, and it is important to get every year if you're going to be immune to the flu. It does not always have 100% efficacy. We see people a lot who have flu who were vaccinated. However, the symptoms are much less severe. HPV, I'm just going to touch on really quick. That is a newer vaccine that we've been administering to children starting usually around age 9 to 14. However, that vaccine does go up to age 26. And so if you are an adult and you're younger than 26, it is recommended that you start that HPV dose. That's the vaccine that causes cervical cancer. Boys and girls should get this vaccine. It's actually, one of the only vaccines we have against cancer. So it's a super important one to be aware of. Pneumonia. This is one that the guidelines recently have changed. Anybody who is 65 and older should be vaccinated against pneumonia. There are a bunch of different types of bacteria that can cause pneumonia. We have a new vaccine called a PCV20. It is available in most doctors' offices, health departments, and that is a one and done vaccine. In the past, there were vaccines that you would get 13 and 23. You would have to get certain number of doses within a certain time frame. But with the newer ones, it's one and done, age 65 and older. If you have any immune compromising something like COPD, diabetes, anything, then you could get that vaccine earlier than age 65. RSV, another new one that is brand new this year, respiratory syncytial virus. Used to be a virus that affected only, children. However, in the recent years, it's hit the 60 and older population quite hard, especially if they have any pre-existing lung disease. And this is the first year we've actually had a vaccine for this. If you're 60 or older, it's just one dose. If you are pregnant and you get this vaccine in your very last weeks of pregnancy, there's been really good evidence that it protects baby from getting RSV. And so babies with RSV are very sick. So again, another one where you're vaccinating yourself, but you're also protecting, the children or babies who you might be exposed to. Okay, I already touched on the HPV one. And so the COVID, sorry, some of my slides, I don't know if they updated when I sent it across. So they might feel a little bit disjointed here, but I saved the COVID vaccine for last because it seems like this is the one that's always changing, always causing the most confusion. Even, for us in the medical field, it's been hard to keep up with the changes. But there's really good evidence that the COVID vaccine has been effective. It's been safe. We've almost are achieving what most professionals would consider herd immunity here in the United States. And a lot of people have received at least one dose of this by now. Occasionally we'll have people coming in, some change of heart and have wanted to, start over getting vaccinated. But regardless of what you've received in the past, it is recommended now that you receive the most up-to-date 2013-14 version of the COVID-19 vaccine. And we started giving this one dose in the fall. For everybody who had been even vaccinated before. And now it's recommended that individuals who are older than 65 or immune compromised actually receive that second dose of the Omicron variant booster. So that's something that's a little new. A lot of doctors' offices now have the COVID vaccine ready and available, as well as almost all pharmacies as well. So all right, and that's all the actual education information that I had written, because I wanted to leave time to kind of see what kind of questions we had and what your experience has been trying to advocate for vaccines, or if you have hesitancy and kind of what your rationales are for maybe not being so sure about some of these recommendations.
This is Marquetta Frost talking about the RSV. It was a huge outbreak here in our community. I ended up with it for my grandson.
Oh, no.
And somewhat, yeah, it was one of the most terrible things I'd ever experienced. But I made it through it. But looking at people that are compromised,
Mhm.
uh, they you have to have insurance to get that one correct. That is not something that you can, like the COVID vaccine that we've been administering has been kind of free, but you've
Right.
had to have insurance to get the other type of vaccines, correct?
Medicare. Yeah. Um,
Medicare.
mhm.
Because she was the lady that said she went to try to go get it. She was turned down, and I'm not sure she had Medicare. But
Was
she
she
could
over
not.
65?
She was older than me, and that's why I was really concerned, because she was told that she could not get it, and I'm not sure of her medical coverage, but I was just
Yeah.
making sure that's something that she should be able to get. Um,
Yeah. So here we have someone who wants to do it, who is willing to, and then being told no because of cost is that's really disconcerting. Um, so I do, and I, yeah, again, I don't, certainly this is not a government sponsored vaccine like the COVID has been. And so it will not be free if you don't have insurance. Um, but I do know that at least there's only two of them. But the RXV is covered by, Medicare plans. So I also wonder, did she go to a pharmacy or did she go to a doctor's office?
I believe she went to a pharmacy.
Okay.
I
I
don't think she
wonder.
went to a doctor. I think she went to a pharmacy and they told her that she couldn't get it. And I'm not sure if she had Medicaid or Medicare, but they told her that she could not get it. And speaking of that, so since I've had RSV, I don't need, do I have immunities now to that, or should I get vaccinated so that I don't get it again?
Yeah, so the RSV vaccine is more one of the more like seasonal protections against it. And you do have a little bit of immunity towards it now, but you can certainly still get it again. Typically, the second infection is not as severe as the first, but I would still definitely get vaccinated. I would talk to your doctor about, the time frame in between, like depending on other health, care issues. But it is not a kind of like one and done infection, unfortunately.
Okay, thank you.
And I think I'm going to look more into that billing issue. I was under the impression that it was covered by all Medicare. Um, if that's not the case, then I feel like I should know about that. So
Okay. Yeah, and I'll ask her again too. She there was some reason they told her no, but I know she went to try to go get it and they told her she couldn't.
wow,
So
has anyone else experienced that before with the RSV vaccine?
Hi, Patricia here. I work in Oakland Gastro. I'm the manager there. We personally don't deal with vaccinations all that often, but I know sometimes diagnosis codes can have a lot to do with Medicare and why they won't cover something.
Yes, you are absolutely right.
I know, it's the beauty of the beast.
Uh-huh. So if you see your friend again, I would certainly have her contact her doctor to see if it can be ordered in some other way. That's a really good point.
I will, because one of the things is one of the ladies passed away because that did catch RSV. It was going around and she
Oh,
had OCP. What is it? What is the lung? She couldn't breathe. Um, OCD. Yeah, I'm sorry.
okay.
You're okay.
Um,
COPD
yeah, I
probably.
couldn't remember the acronym, but
Mhm.
she had that and she did pass away. Not the lady that I'm talking about, but the lady that I am talking about only has one lung. And so that's why she was very concerned about getting RSV because it is horrible. You can't hardly breathe, and it's terrible. And so she was trying to do something to prevent getting it, since it was going around people that we knew that was receiving dialysis, and they told her no, and that was very concerning to her. So I'm not sure what code she had or whatever, but I'll just ask her again, was she able to get it? But
yeah, and if she has a doctor, I mean, a lot of times just have her call her doctor, and they'll be able to advise her better about like what to do or where to get it.
okay,
Like, yeah,
thank you.
What other questions do we have? Talking about RSV, being that that's a new one, has anyone like personally like been a little hesitant just because this is like the first time we've been administering this?
I know I thought I didn't need
members?
it. I thought I didn't need it until I got RSV, but I got it from my grandson who had contracted it at school, and he's only 4, and I babysat him and got it. So pneumonia, RSV, and with my compromised immune system, I do understand that's something important for me to get. So I'll be looking into it, but I was hesitant before because I was COVID vaccinated, but I didn't have the other ones.
Right. And it's kind of been like we've been having people like get the COVID vaccine. Now we're saying like get the RSV vaccine. It's brand new. And I run into a lot of hesitancy just because people think if it's new, you know, they don't know what's wrong with it yet. But you know, the reality is these things have to be studied for a long time in order to get the approval, and they have to be passed through several stages of research, and a certain number of people have to have received them. So it's not like it's new, you know, a month ago and they just started giving it to people.
I do have a question about the RSV vaccine.
Yeah.
Do you know if it'll end up being available to like children at any point soon?
So that is an awesome question. This year actually was the very first year we've had an RSV vaccine for children. Now, I say vaccine, but actually what it is, it's different than the adult one, but it's basically an immune modulator. And so it's a medication we give infants that will reduce the severity of RSV should they get that. We were all very excited about this. It was approved for like newborns through, you know, up to 9 months old. However, not enough of it was manufactured, and hardly anybody was able to have this in their offices to give children. Which again, it's one of those things like I don't understand how those things happen, you know, from a manufacturing standpoint. But yes, it is available. I think next year will be much better. And so I foresee that like RSV deaths and severe illnesses will start to get a lot better now that we have these tools available.
Well, that is awesome. I have 2 younger kiddos myself that both have asthma. So, and I have it as well. So I've been kind of like worried about it, and I've been wanting to get it done for them, but it's not available for their ages yet.
Yeah,
they're 4 and 6. Yeah.
Yep. But I know, and typically, you know, 4 and 6-year-olds will do quite well with RSV, unless like I know they have asthma. And so the thought is, you know, if we vaccinate enough adults, enough young babies, then hopefully like it'll reduce the burden of everybody together. So.
Yeah, hopefully it gets better soon. I know this season was really hard on everyone.
Yeah, it was an interesting respiratory season for sure. I feel like this year was better than last year for the kiddos. It seemed like our immune systems last year just weren't quite primed for the things we were encountering after taking off our masks, and we really got slammed. That being said, every single winter in Michigan, it's like, you know, it's one thing after another. And so having some protection against, you know, these respiratory viruses for old people and kiddos is like, it makes me breathe easier as a doctor. But I still run into so much hesitancy and many people refusing to get these newer vaccines.
Question. Go ahead. Go ahead. Can you hear me?
I can hear you.
Yes, my name is Mr. Clayton, and I live in the Washington Heights area in Battle Creek. The question is, you have to be 65 to participate in this, and can you tell me why you have to be at that age?
For the RSV vaccine,
Yes,
it's 60 and older.
60 and older?
Yes.
Okay.
Yep. So typically that is just because people who are in that age range are typically more immune compromised. And so they're more at risk for complications from RSV. And that's, I'm saying typically because there's always outliers, right? Severe COPD, heart disease, asthma. So there's exceptions when those things occur. However, with the RSV vaccine, they really stuck to that over 60 age range. And I don't know if it was because, of cost or supply. But most of the time it's because people over 60 are just less able to tolerate the disease.
Okay. Thank you.
Lorraine,
Thank you
it
for
looked
the
like you had sorry. Lorraine, it looked like you had a question. Oh, you're muted now, by the way, Lorraine.
Okay. It's I have a 4-year-old great grandson and a 2-year-old granddaughter, and their daycare and preschool, it's like a stomach virus going around.
Mm-hmm.
So it's the stomach hurt and the throwing up and all of that.
We've been seeing a ton of it. It went through my house, not too long ago too. I have kids about the same age, and I'll tell you, there is not a vaccine that we found against that one. Unfortunately.
But the best thing to just give them fluids then.
Yeah, I mean, with those GI viruses, they spread like wildfire. The best thing is hand washing. A lot of them that aren't respiratory spread, if you can get those kids and adults to wash their hands all the time, no matter, every hour on the hour, that will really reduce the spread. But if they do get it, push in the fluids. Absolutely. Looking for dehydration signs.
I do want to bring up a question for the group, because one of the things that you will often hear is folks concerned about the different risks of getting vaccinated, including if that vaccine will give you the disease that it's aiming to prevent. So what are your thoughts there?
Well, I've had ones to tell me that the vaccine made them very ill.
Yeah,
So
yeah, definitely. I hear that all the time.
Yes, and some of them say, I'll never take it again because each time I took it made me very ill. So
yep. That probably is one of the biggest ones that I hear as well, especially with the flu vaccine. And doctors, we always kind of like, I believe my patients, I believe they've been, they are sick from these vaccines, but it's an inactive virus. Like there is absolutely no way that getting a flu shot can give you the flu. There's no way. There's no live anything. There's no live organisms or anything in that vaccine. I think what happens is a vaccine is designed to tell your body to mount an immune response. It's introducing a small amount of, of DNA or of a molecule that tells your cells, hey, recognize this pattern, recognize this sequence, so that if you do encounter it in a larger amount down the road, your immune system is going to know what to do. A lot of times when you are starting to mount an immune response, you do get a little feverish. You get flushed, a little achy. You can get a fever for sure. And some people might consider that, getting the flu. You can still get sick from anything else like this GI virus you were referring to. It's been awful. That's not the flu. It's not RSV. It's not COVID. I don't know what it is, but you can still get it no matter if you're vaccinated or not. So I think, maybe people think if they vaccinate, they shouldn't ever get sick, and that's just not the case.
But the ones that have spoken to me are concerned in the the COVID shot and the flu shot. They have taken both, and both of them have made them sick.
Yeah. Yeah, certainly. I have patients tell me that that immune response that, the vaccine is designed to entice. I mean, that doesn't feel good. That's, fevers, aches, pains. I mean, it certainly can happen. That is not a common reaction, but it's certainly something that we know about and that is considered to be a normal response. I think it's really hard to explain that to be a normal response to a patient. They're like, well, why would I get this if it's going to make me feel this bad? And I'll tell you, a lot of doctors will feel, especially with COVID being as bad as it was 2 years ago, they were relieved when they felt sick after getting the shot, because that meant it was actually like in their body and working. So that's just the two different perspectives. But I think that's a really good point. It's how our bodies work, our immune systems, and there's not a whole lot to do about that other than just, Tylenol, Motrin the day after, and good hydration.
In other words, the flu shot and the COVID shot, it affects each person a little bit different. It depends on your body chemistry.
Absolutely. Like personally, I've never had a reaction to a vaccine. My kids have never had one. But many people do. So you're right. It's very much individual. I really try to emphasize that reaction that you're getting is so much less severe than the actual disease itself. There's other, and there's certainly risks to vaccines that I can go over. Certain ones that are very rare, but almost everybody knows somebody who, had something terrible happen after, a vaccine, or we've heard about it on the news. And so there are some contraindications that I can talk about if we're interested in hearing about that. I tell my patients, everyone who gets vaccines, to watch out for certain signs. I would consider, just like fever, not feeling good, to be something normal. Some very rare events would be like Guillain-Barré. And so very rare, but it's a thing that can happen with vaccines. It can happen with the flu vaccine, and that's, basically, ascending paralysis, breathing difficulty. There are some people who do have an actual allergy to an ingredient in the vaccine, and they have an anaphylactic reaction. Again, very rare, but it's certainly something that that is possible.
I do have a question. I'm Tammy. I'm a care manager for OMG Marshall Primary Care. So I get patients that often, call me and they'll say they have a reaction. They think they have a reaction to vaccine, and most of the time it's just that, I'm building antibodies to this. I've got a fever, I've got body aches and whatnot. But at what point in time is there a concern as far as a fever being too high? Is there a cutoff for, a temperature that's 100.3 versus a temperature that's 104 post-vaccine for an adult?
Yeah.
What's the cutoff that where I should tell them, you need to come in and be seen versus wait it out?
Sure. I think at that point in time, when that happens, if it descends or, goes up beyond a certain point and that patient is feeling really terrible after 24 hours, I would be very suspicious of a different infection. They're sick with something else causing this. And it really probably wasn't made any better by the vaccine, but was not caused by the vaccine.
Okay.
And so with kids, the concern is febrile seizures, right? Because, that can happen. And so that's why we really tell parents, watch them close. There's absolutely nothing you can do to prevent a febrile seizure if your child is prone to getting them. But we time the vaccines the way they're distributed and given in a way that gives the lowest risk possible. But I would say, like, if you just in advising patients, like blanket statement, anything beyond 24 to 48 hours that's not improving needs to be looked at by a physician or, healthcare provider.
Okay, thank you.
Yeah,
I have a question, Al Williams. At what level is that information kept at, the vaccine and shot information kept at it?
Okay, say that one more time. I think you cut out a little bit.
Okay, at what level is the vaccine information kept at? Is that kept at a county level, state level? How do you know what you've had and what you haven't had for sure?
So in terms of like the ingredients in the vaccine,
No, the shot itself, the vaccine itself. I mean, is it kept at a state level or is it kept at a county level?
So when you like the distribution of it, like who gives the doctor's offices the vaccines?
Okay, if I go to the doctor and I say, I don't know what shots or vaccines I've had, is there any place that is keeping a record of that?
Yes, absolutely. There is a state database for everybody that will tell you all the vaccines that have been administered to them.
Okay,
So
thank
like
you.
when all my patients who come in, we really try to have been doing this for everybody, printing a MICR. Our nurses and MAs have access to what we call MICR, can search for a patient and see their vaccines. That way you can see what they're due for. Pharmacies have this as well. And so that's the best way to keep track of it.
And what if you move from state to state? Is that information transferred, or is there any way that you have getting it from one state to the other state, or you have to call the state or what?
Yeah, that's a really good question, because that's one problem we do have is, if we have kiddos or people moving from state to state, we usually have to contact their doctor's office and ask for those records to be sent to us. Yep, so it's state level.
Any final questions? We are just coming up on 6:30.
So I would say, like, kind of just in summary, for adults, to keep yourselves healthy, to keep the people around you healthy. If you have a doctor, when you go to, even if it's for something like a cold, ask them if there's vaccines you're due for. I try to keep up with, my patients, but every time every day I'm finding something that they could be due for. It doesn't have to be during your physical. It's not too hard for, an office to pull up a MICR and say, hey, you're due for this and this. They even can give you their your vaccine record. Because chances are, if you're moving up towards that 50 to 60 range, you are due for that pneumonia vaccine or the shingles or something.
Okay, well, thank you everyone for joining us for tonight's training. Again, we'll just remind our ambassador team leaders, make sure you send me a list of the folks from your group attending today if you haven't done so already. If I see their name on the screen, though, I have recorded them, so don't worry too much. And if folks haven't been able to join, we will have a recording available in the coming days for them to watch. But thank you all again for getting us great information, and thank you, Dr. Kantola, for sharing it with us about adult immunizations. And we look forward to being able to share this information around the community, whether you attended this training as an individual or if you're part of our regular ambassador volunteer.